Have you ever felt the relentless pressure of an invisible force steadily building within? A force that doesn't shout, but silently strains against the very walls of your being. That force is hypertension, and it's far more than just a number on a chart. It's a story written in the resilience and the vulnerability of the human body. We often talk about blood pressure as if it's a simple metric, a clinical reading. But imagine your circulatory system as a complex network of rivers, carrying life-giving sustenance to every cell. Now picture those rivers narrowing, constricting, forcing the heart to work harder, to push against increasing resistance. That struggle, that constant exertion, is the essence of hypertension. For nearly 9 out of 10 people who face this condition, it's what we call essential or primary hypertension. It doesn't arrive with a single, identifiable cause, but rather develops gradually over time, a subtle accumulation of factors. Think of it as a slow hardening of the arteries, a thickening of the vessel walls, subtly reducing the inner space for blood to flow. A garden hose, once flexible and open, becoming rigid and constricted. This reduction in diameter isn't merely a physical change, it's an increase in systemic vascular resistance. And that resistance, relentlessly pushing against the heart, elevates blood pressure. But what fuels this process? What sets this cascade in motion? Age is a significant factor. With each passing year, our vessels naturally lose some of their elasticity, becoming more prone to calcification and thickening. It's a natural part of aging, but it doesn't mean we're powerless against it. Smoking accelerates this process, damaging the delicate lining of the arteries and promoting inflammation. Diabetes, too, casts a long shadow, contributing to vessel wall thickening and increasing the risk of hypertension. These are the silent architects of this slow transformation. Beyond the physical changes in the vessels themselves, there's another dimension, the influence of our nervous system. Sometimes the body's fight or flight response becomes overactive, causing a constant, low-level constriction of blood vessels. Imagine being perpetually poised for action, even when at rest. This chronic state of heightened alert keeps the vessels narrowed, increasing resistance and elevating blood pressure. Stress, that ever-present companion in modern life, can play a significant role. And then there's obesity. It's not simply about weight. It's about the release of inflammatory substances, cytokines, that contribute to vessel wall thickening and increase sympathetic nervous system activity. The body, in a state of chronic inflammation, subtly shifts the balance towards higher blood pressure. But what about the other 10%? These individuals experience secondary hypertension, where high blood pressure is a symptom of an underlying condition. This is where the detective work begins. Refractory hypertension, blood pressure that stubbornly resists treatment with multiple medications, is a key indicator. It's the body's way of signaling that something deeper is at play. One of the most common culprits is kidney disease. The kidneys play a crucial role in regulating blood volume and blood pressure. When they're damaged, they can't effectively filter sodium and water, leading to fluid retention and increased blood pressure. Imagine a faulty plumbing system, unable to effectively manage the flow of water. Renal artery stenosis, a narrowing of the arteries supplying the kidneys, can also disrupt this delicate balance. Endocrine disorders can also be responsible. The thyroid, a tiny gland with immense power, can contribute too. Hypertension, if it's overactive or underactive. An overactive thyroid increases cardiac output, forcing the heart to pump harder and faster. An underactive thyroid, conversely, causes vessel constriction. The adrenal glands, too, can play a role, releasing hormones like aldosterone and cortisol that increase blood pressure. Pheochromocytoma, a rare tumor of the adrenal gland, can flood the system with adrenaline, causing dramatic spikes in blood pressure. Neurological conditions can also contribute, particularly those that increase pressure within the skull. This increased pressure can trigger a cascade of physiological responses that elevate blood pressure. Aortic diseases, like coarctation of the aorta, a narrowing of the aorta, create a pressure gradient, resulting in high blood pressure in the upper extremities and low blood pressure in the lower extremities. And then there are conditions like preeclampsia, a serious complication of pregnancy characterized by high blood pressure and protein in the urine. It's a complex interplay of hormonal and vascular changes, driven by the body's attempt to ensure adequate blood flow to the developing fetus. But regardless of the cause, hypertension is a silent threat, a slow erosion. Cardiovascular health. What does it feel like? Often nothing at all. That's why it's often called the silent killer. But the consequences of unchecked hypertension are far from silent. Over time, the constant strain on the heart leads to left ventricular hypertrophy, a thickening of the heart muscle. Imagine a weightlifter constantly straining against heavy resistance. Their muscles grow larger, but their flexibility and efficiency diminish. Similarly, the thickened heart muscle becomes less efficient at pumping blood, eventually leading to heart failure. Hypertension also accelerates atherosclerosis, the buildup of plaque in the arteries. These plaques narrow the arteries, restricting blood flow and increasing the risk of heart attack, stroke, and peripheral artery disease. It's like a gradual clogging of the rivers, impeding the flow of life-giving sustenance. And the potential for disaster doesn't end there. Hypertension can weaken the walls of the aorta, increasing the risk of aortic dissection, a tear in the aorta or aortic aneurysm, a ballooning of the aorta. These are life-threatening conditions that require immediate medical attention. In the brain, hypertension can damage small blood vessels, leading to cognitive decline, stroke, and dementia. In the kidneys, it can accelerate the progression of kidney disease. And in the eyes, it can cause hypertensive retinopathy, damaging the delicate blood vessels in the retina and potentially leading to blindness. So how do we diagnose hypertension? The first step is accurate measurement. Blood pressure should be checked in both arms, and multiple readings should be taken over time to account for variations. If blood pressure is consistently elevated, further investigation is needed to rule out secondary causes. Ambulatory blood pressure monitoring, where blood pressure is measured repeatedly over a 24-hour period, can help distinguish between true hypertension and white coat hypertension, elevated blood pressure in a clinical setting due to anxiety. Treatment of hypertension typically begins with lifestyle modifications, weight loss, a healthy diet, regular exercise, and reduced sodium intake. These are the foundational pillars of cardiovascular health. For those with stage 1 hypertension and a high risk of cardiovascular disease, medications may be considered. For stage 2 hypertension, medication is generally recommended. The choice of medication depends on individual factors, such as age, ethnicity, and the presence of other medical conditions. ACE inhibitors, ARBs, thiazide diuretics and calcium channel blockers are commonly used. In cases of hypertensive emergency, where blood pressure is dangerously high and accompanied by target organ damage, immediate medical intervention is crucial. The goal is to lower blood pressure quickly but carefully, avoiding a sudden drop that could worsen organ damage. Intravenous medications like nicardipine, esmolol, and nitroprusside are often used. Hypertension is a complex and multifaceted condition, but it's not insurmountable. With early detection, lifestyle changes, and appropriate medical management, it can be controlled, and its devastating consequences can be averted. It requires a commitment to self-care, a willingness to make healthy choices, and a partnership with your healthcare provider. Because managing blood pressure isn't just about lowering a number. It's about protecting your future, preserving your quality of life, and honoring the incredible resilience of the human body. It's about choosing to live with strength, with vitality, and with a heart that beats strong for years to come.